Dr. A, this is Danny. This is my video assessment number 1. This is my client right behind me, Diana. And the first movement that we're going to go into is we're going to do a two-legged overhead squat from the anterior view. A couple things that I'm going to be looking for here is I'm going to be looking at her knees and also her foot and ankle complex. So what I want her to do essentially is I want her to take both of her feet and I want her to point them as straight as she can, okay? So her feet are going to be straight. Then from here, she is going to take both of her legs and she's going to widen them out pretty much to about hip or armpit width. So as you can see, she has her feet about armpit width. So if you notice, her right foot still a little externally rotated, so we're going to take and turn that in a little bit more. There we go. All right, now she's going to take both of her hands and she's going to put them straight up overhead, okay? If you notice her right hand back a little bit, and what she's going to do is she's going to hinge at the hips and she is going to squat down like she's sitting in a chair. So go ahead, okay, stand back up, okay, do about 4 more reps for me, please, okay? Okay, you keep your arms straight. Yeah, there you go. Try and keep your arms as straight as you can. Okay, 1 more, please. All right, excellent. Go ahead. Go. So this is the second test of the assessment. We're doing a two-legged overhead squat with my client's heels are elevated. We have 2 books placed on the floor that are about 2 inches thick. She's essentially going to follow the same protocol that she did previously, with the exception of now her heels are elevated. So as you can see, she has her feet already about hip width apart. She could actually widen those just a tad, okay? Her feet are pointing straight ahead. She's going to go ahead and lift both of her arms straight overhead, and she is going to go ahead and she's going to squat down like she is sitting in a chair whenever she is ready. All right, go ahead. All right, try and keep your arm, there you go. Yep, try and keep those arms back. There you go. Okay, whenever you're ready. Bring your arms back a little bit more. There you go. So the next test we're going to transition to is the 1-leg squat. My client is going to be facing the camera as she already is. She's going to put her feet together. She's going to lift her left leg. She's going to lift her left leg in the air, not quite like that, just slightly, okay, just slightly. And she's going to put her hands on her hips, and she's going to do 5 single leg squats, almost as if she is squatting down to sit in a chair. That's okay. That's okay. Keep going. There you go. Okay. Okay. That's okay. One more. Okay, so we just performed the single leg squat, testing the right foot. Now this time my client, she's gonna have her feet together and she is gonna lift her right leg slightly off the ground. Her hands are still on her hips and she's gonna perform 5 single leg squats. You're fine. One more. All right, so transitioning on, we're now going to perform the push-up test. As you can see, my client is going to perform the push-up test on her knees, and she is going to maintain that nice neutral spine right here. And she's also lift your head up, please, a little bit. There you go. Just now push it down. There you go. That's perfect position right there. All right, and whenever you're ready, go ahead and perform 5 push-ups for me. All right, try and get a little bit lower with those push-ups. Okay, couple more. Couple more. And a couple more. All right. All right, so now that we've finished our push-up test, the next test that we're gonna do is the series of shoulder movements. And the first thing that we're gonna test is shoulder flexion. As you can see, my client, she's standing up against the wall. She has her, I'm just gonna take you with me just for a sec here. She has her shoulders, her head, her glutes, and her heels are all against the wall. If you just take this foot back, there you go. Now everything is completely against the wall as the testing protocol calls for. So I'm gonna take you back over here. All right, and what my client is gonna do is she is gonna attempt to raise her left arm straight overhead and touch her thumb to the wall behind her whenever she is ready. So, go ahead. Okay, back down. Go ahead. Okay. Again. Okay. Okay. Now, transitioning from her right arm, she's going to go ahead and she's going to perform the same movement protocol with her left arm. Okay, go ahead and try and keep that arm fully extended. Okay. 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 All right, so our next shoulder movement test is going to be internal rotation. So as you can see, my client, she's still standing with her back up against the wall. She does not have her heels against the wall, so she's going to need to go ahead and put her heels against the wall like so. And from here, she's going to take both of her arms, she's going to abduct them to about 90 degrees, and then she's going to flex her elbows to about 90 degrees as well. Now from here, she's going to take her right arm, and then she is going to try to rotate her right arm all the way down until the midline of her trunk. And then she's going to come back up. All right. So whenever you're ready, go ahead, do that about 5 times. And while she's doing that, she's going to keep her left arm completely at 90 degrees. So go ahead whenever you're ready. Okay. 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 Now, transitioning from here, from her right side, she's just gonna gonna do the same thing on the opposite side. She's gonna keep her right arm abducted to 90 degrees, and then she is gonna use her left arm to try to internally rotate all the way down until the midline of her trunk. As you can see, she's a little tired, so she's gonna shake it out. She's gonna reset herself, and we'll go from there. So whenever you're ready. All right, go ahead and bring that. There you go. There you go. Okay. 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 So from here, we're going to move from internal rotation to external rotation. So pretty much the same setup as internal rotation. My client, she's going to have her glutes, her heels, her shoulders, and her head against the wall completely. She's going to abduct her shoulders to 90 degrees. She's going to flex her elbows to 90 degrees as well. And from here, instead of rotating internally, she's going to rotate externally. And she's going to attempt to touch the top portion of her hand to the wall. So whenever you're ready, as you can see, she's starting with her right arm. Okay, just out. Okay. Now from here, she's just going to transition right over to her left arm. Okay. Okay. One more. So transitioning to our final shoulder movement, we're going to move to the horizontal abduction shoulder movement. My client, she's going to, as she is standing right now with her back, her glutes, her heels, her head against the wall, she's going to bring her arms straight out in front of her. She's going to make sure that those shoulder blades are still touching the wall behind her. And then from here, she's going to start with either her right or her left arm, and she's going to attempt to touch the top portion of her, or the back of her hand. She's going to attempt to touch that to the wall. So whenever she is ready. Okay, a couple more. Okay, now from here, she's essentially going to maintain the same testing protocol, and she's just going to transition from her right arm to her left arm. All right, so now that we've moved through our shoulder movements, now what we're going to move into is a series of trunk flexion and trunk rotation tests. So the first thing that we're going to look at is we are going to look at trunk flexion. So what I'm going to do is I'm going to have my client stand with her back, her glutes, her shoulders, and her heels up against the wall. Now, a couple things that I'm going to look for here is I'm going to look that her feet are about armpit width apart. I don't want them to be too wide, because that's going to give her an easier position, or it's going to give her an easier way to touch the tip of her middle finger to the lateral aspect of her knee. And I don't want them to be too close. because that's going to make the movement too hard for her. So I want it to be I want that kind of happy medium position. So as you can see, she's got her heels against the wall right here. She has her glutes, she has her shoulders back. She could actually widen her feet just a tidbit. All right, scoot that one in. There we go. Okay, so what I'm going to do is I'm going to take you over to a different view here. All right, so as you can see, let me put you back a little bit. See if I can get a better angle here. All right, so from here, what my client is going to do is she's going to try and touch the tip of her middle finger all the way down. She's going to flex at the trunk, and she's going to try and touch the outer portion of her knee right here, which I'm going to hold my arm right here, and she is going to try and touch my hand with the tip of her middle finger. Now, a couple things that we're looking for here. We're looking to make sure that both of her shoulder blades stay against the wall. Typical compensation for this movement is shoulder blades tend to come off of the wall. We're also looking for any sort of hip movement. It's pretty typical compensation is for the opposite or the contralateral side, the hip, to come off of the wall when there's limited range of motion. A couple other things that we're looking for is to make sure there's no movement in either of her feet, and also to make sure that there is no flexion in any of her knees to help her get into that position. So she's going to go ahead, when I instruct her to go, she's going to do about 5 repetitions of this to see if she has the movement efficiency to be able to do this. All right, so I'm going to hold my hand right here at the outer portion of her knee, and whenever you're ready, you can, okay, back up. Okay. All right. So from here, what we're going to do is we're actually going to transition, and we're going to go from her right side to her left side, and we're going to take a look at her left side now. So what I'm going to do is I'm going to switch you around here, and we're going to move down a little bit. Okay, so now we have my client's left side, and I'm going to hold my hand. See if I can get a better angle here. All right, so I'm going to hold my hand right here at the outer portion of her knee, and she's essentially going to do the same thing over again. She's going to try and keep her fingers as straight as she can, and she's going to flex her trunk, and she's going to attempt to touch the top of my hand with the end of her middle finger. So whenever you're ready. Okay, a couple more. Okay. All right, so now that we've done our trunk flexion test, the next thing that we're going to do is our trunk rotation test. So what I'm going to do is I'm going to have my client, she's going to take about a foot step away from the wall just to make sure she's able to rotate freely. What she's going to do is she's going to cross her arms like so. So go ahead, cross your arms. So kind of bring them down a little bit. There we go. Now what we're looking for here is when she turns, we're looking for about 45 degrees of rotation. So what that means is when she rotates, kind of like so, I'm looking to see if the anterior portion of her deltoid, of her deltoids, is in line with her ASIS, right here, this bony landmark right here. Okay, so a couple things that we're also looking for is we're looking for any excessive movement in the frontal or the sagittal or the transverse plane. So any rotation of the hip, any awkward rotation of the shoulder, all of those would indicate a compensation, meaning that she doesn't have the necessary range of motion to be able to perform this movement properly. So what I'm going to do is I am actually just going to keep watch on her shoulders as she does this, just to make sure that when she rotates, if we were to drop a plumb line from the anterior portion of her deltoid down to her ASIS, right in this area right here, that the anterior portion of her shoulder would be on the inside portion of her ASIS. So she's going to do about 5 on the right side, and then she's going to do about 5 on the left side as well. So whenever you're ready, go ahead and turn to the right. Okay? Okay, now hold it right there. So as you can see, the anterior portion of her shoulder, if we were to make a straight line all the way down right here, she would be on the inner portion of her ASIS right here. I know it's kind of hard to see in the video, but her shoulder is on the inner portion of her ASIS. So go ahead and do a couple more. Okay. All right, one more. Okay, so what I'm going to do now is I'm going to have her do a couple more of the same movement. What I'm going to do is I'm actually going to hold her hips, and what I'm feeling for is any pressure in her hips. I'm trying to determine if she is moving her hips as she is turning to the right, which would also indicate a separate compensation. So I'm going to grab her left hip, or her right hip right here. I'm going to grab her left hip right here towards the back, and as she rotates, I'm feeling for any pressure. So go ahead. No, other way. Okay, a couple more. Okay. All right, so that was the trunk rotation test to the right side. So what we're going to do now is we're going to shift from the right and do the left. All right, so whenever you're ready, same thing that you just did, but go to your left this time. All right, now freeze. Okay, now from right here, you can see the anterior portion of her shoulder, her ASIS, is right about where my thumb is. I know it's hard to see with the video. However, the anterior portion of her shoulder, it is to the inner portion of her ASIS. So when she comes back in this neutral position right here, what I'm going to do is I'm going to do that same movement with her hips. I'm going to place my left hand right here, and I'm going to place my right hand right here, my left hand right here. I'm going to feel for any pressure in her pelvis as she rotates to the left. So go ahead. Okay, a couple more. Two more. Okay, one more. All right, outstanding. So now that we've done our trunk rotation test, we're going to move into our cervical lateral flexion test. So as you can see, my client she's standing up against the wall, and what she's going to do is she is going to try and achieve 45 degrees of lateral flexion in her cervical spine. So when I give her the command of go, or when I tell her she can begin, what she's going to do is she's essentially just going to try and flex her spine kind of like I'm doing right now, until I believe that she is achieved 45 degrees. So one tactile cue that I'm going to use here is I'm actually going to take about 3 fingers right here. I'm going to set them on the top of her trap. That way it just gives her kind of a go-to point. That way she knows when she's kind of achieved that 45 degrees of lateral flexion. So a couple things that we're looking for here is if you kind of watch my neck right here, a lot of people, when they tend to do this, they tend to kind of look down, kind of like so. Also, they tend to raise their shoulder of the side that they're flexing towards, and they also tend to kind of raise the opposite shoulder, and those are all compensations that we would normally see with this movement. So I'm going to go ahead and have her start on the right side. I'm actually going to hop on the other side here, and I'm going to place those 3 fingers right on her trap right here. And whenever she is ready, she's just going to do 5 repetitions of lateral flexion to her right side. So whenever you're ready. Okay? Okay? One more. Okay? So that wasn't bad. So now that we've done the right side, I'm going to go ahead and hop over and we are going to do the left side. Okay? 3 fingers, once again, right on top of her trap. And whenever you're ready, you can go ahead. 5 reps, please. Okay, a couple more. Couple more. One more, actually. All right. So that right there was the cervical lateral flexion test, and from here we're going to move to the cervical rotation test. So the last test that we're going to do in our movement efficiency series is we are going to do cervical rotation. So as you can see, my client, she's standing up against the wall. She's going to go ahead, she's going to widen her feet just a tad, and what she's going to do is she is going to attempt to rotate her head to where the corner of her mouth is in line with the anterior portion of her shoulder. So what we're looking for is about roughly 65 degrees of rotation. So I believe for this test it would be best if I get a different angle here, so bear with me. All right, so I'm just going to move you right over here. All right, so from here, we get kind of a better view of my client. So as you can see, she's standing, she's got her head in a nice neutral position right here. And from here, she's going to do about 5 turns to her right side. And like I said, we're looking for that 65 degrees of rotation. So whenever you're ready, go ahead. Okay, now from here, right, what we're looking for is we're looking for the corner of her mouth right here to be in line with the anterior portion of her acromion process, which is this bony landmark right in here. So go ahead and go back to facing straight forward. All right, and do a couple more reps for me, please. Okay, and a couple compensations that we're looking for as she's doing this movement. We're watching her shoulders to make sure that her shoulders don't rotate forward off of the wall. We're also watching her head position to make sure that her head does not protract forward. And we're also watching her head to make sure that her head also doesn't go into an excessive extension as well. So one more. Okay. Now from here, we're going to transition from the right side over to the left side. So Stand by while I move you. All right. Now from here, she's going to essentially go through the same movement, only it's going to be to her left side now. Okay, so whenever you're ready. Okay, now from here, as with the right side, go ahead and rotate again. Okay, we're looking for the corner of her mouth, or the corner of her mouth right here, to be in line with the anterior portion of her acromion process, which is this bony landmark right in here. All right, so go ahead and do a couple more reps for me. We're also watching her shoulder complex as well to make sure that's not coming off of the wall. We're watching her head position as well to make sure she's not protracting forward, to make sure that she's not doing any excessive extension in her head as well while she's performing this movement. So a couple more reps, please. Okay,